We'll move on to Nita next. Nita, you do work on modeling and also advisory work on pandemics. So acknowledging, like Martin was saying, that many of the decisions will have to be made with imperfect information. They will have to be made with a great degree of uncertainty in the model for all the reasons that you all know much better than I do. So in such a context, how do you advise people so that the decisions they make are rational or at least are proportionate to the risks that are seen or are in some ways taking into account the uncertainty that exists?
Thank you for having me today to speak on this topic. It's a very important topic. So when we think about models, models are tools that we can use to help us to make decisions. And there's different types of models that we can use. Some of these include statistical forecasting models, where we're looking at what does the data today tell us about someday in the future. We can have models where we're introducing biological concepts, such as the epidemiological models that have been around since the 1920s that Gordon mentioned. And these can be very useful as well for helping to assess how a disease can spread within a population and to account for some of the factors such as mitigation measures that could be implemented or differences in behavioral factors that could either increase or decrease the spread in runtime. One area where I think it's not thought as much in the public health space, but it is in the insurance space, is catastrophe modeling, which is it's a method of probabilistic modeling that's looking at many, many, many different potential scenarios and trying to estimate what is the probability of a certain type of event happening in the next 12 months, for example. So what we've done at AIR, and others have done as well, is to try to look at the probability of these different types of events, accounting for things about how different diseases can spread in different populations, and accounting for how, for example, Ebola spreads differently from flu. And so the mitigation measures that are available are different, and how people will respond when it happens can be different as well. So when we're trying to look at how this broad picture would look for hundreds of thousands of different simulations, we are actually trying to incorporate some of that uncertainty that Prashant has mentioned. So the uncertainty comes both from the infrequent nature of pandemics. As has been mentioned before, we've had about 4 in the past 100 years, depending on which ones you count. So when we have such a few numbers of events, that's going to increase the amount of uncertainty we have. But that shouldn't necessarily stop us from trying to come up with these estimates. So what we can do is look at some of these historical events, including things such as some of these parameters, such as the R0 that was mentioned, the CFR that was mentioned, and putting together many different combinations of these variables that could be taken from statistical distributions, as well as looking at where an outbreak can start and what is the response capacity in those locations. We can actually model how a disease can spread at a local level or regional level or a global level. And we can do this hundreds of thousands of times to try to get at an answer. Now, the uncertainty is going to be there, and it's there with any type of data measurement, and even more so in outbreaks. So in addition to having the infrequent outbreaks in pandemics, we also have this problem where the data that we're getting, especially at the beginning of an outbreak, may have issues with the reliability, there might be underreporting. So these are questions that basically make us have to look at many thousands of simulations to try to understand the problem. So when we're looking at, for example, hurricanes or earthquakes, we might be able to try to estimate up to the 10,000, a 1 in 10,000 year type of probability. But when we're looking at pandemics, in order to really feel like we're getting a good handle on the very extreme events, we're really looking at 500,000 samples for the estimates for potential events. So if we can improve the data quality that we're getting to help make these decisions, that can help reduce the uncertainty and potentially help to drive the decisions. And this can have different implications. For example, if we're trying to do forecasting, then because of this level of uncertainty, trying to forecast all the way, if it's just the beginning of an outbreak, and then you're trying to forecast to the end of the outbreak, that might be 12 months, 18 months, that's going to be quite a challenge. And the uncertainty band that you would see from trying to estimate that would be quite wide. But if you can narrow that down, if you're trying to look at, well, we have the data from today, what does that tell us about what could happen in the next week, or what could happen in the next month, then that helps to reduce that level of uncertainty that you could see.